Truths. Each year, tens of millions of Americans head to their doctors because of a headache. Many of those cases are not linked to a serious illness. So how can you tell if your headache is a minor irritation or a major problem? Tension headaches. Just about all of us have had them at some point. A couple of aspirin and some rest, that usually does the trick. But for others, things are not so simple.
It's like somebody sticking an ice pick through my eye.
I would go to bed, and they didn't know why I wouldn't eat, why I wouldn't sleep.
Millions suffer from severe headaches, migraines.
Migraine is a chemical imbalance in the brain, and we know that there is a chemical or neurotransmitter called serotonin, and that is what causes migraines.
Migraine headaches are generally hereditary, can develop on one or both sides of the head. They are throbbing in nature, and they are sometimes accompanied by nausea and increased sensitivity to light and noise.
Hey, Melody. How are you?
Melody Allensworth knows that all too well. She was first diagnosed with migraines 6 years ago.
No one understood why I was having headaches. They were just like, she's having headaches. What do we do, mainly? And as I got older, they got worse.
After years of living with migraines, Melody met Dr. Natarajan, who helped identify her headache triggers. Turns out, Melody was her own worst enemy. She was classified as an overachiever, and when her migraines kept her out of school regularly, the problem snowballed.
When I realized that I was getting B's and C's, like as final grades, I cried. I cried for a good amount of a year. Every time I'd get one, I'd cry.
Stress, lack of food and sleep, all were making the headaches worse. But once Melody knew the headache triggers, she knew she could control the headaches. Proper medication and stress management were critical and just what the doctor ordered. Now, Melody has seen the frequency of her headaches drastically reduced.
I would get them maybe every 3 to 4 days. So it would be like 2 to 3 a week. Now that I've gone through all of these medications and treatments, I get maybe 2 a month. So it's a huge improvement.
Yet another type of headache, the cluster headache, is making life miserable for many. Clusters usually target one side of the head. They can last minutes to hours and occur day after day at a similar time over a period of weeks. They are more common in men, but a growing number of women are having problems with them as well.
Severe headache. It's probably the worst type of headache you could have. It's excruciating pain.
Debilitating. You can't do anything. I mean, it's a pain in your head, so therefore you can't think, you can't read, you can't see anything, you can't do anything.
Chris Stafford has suffered with cluster headaches for 26 years.
It made me scared. I thought that something was wrong with me. They were happening too frequently and on a regular basis.
After only a few visits, Dr. Natarajan is helping Chris make the lifestyle changes that could finally bring about some control. Medication and a pledge to quit smoking certainly has Chris optimistic about his chances of finding relief from his headaches. Dr. Natarajan says many people assume the worst about a recurring headache, such as an aneurysm or meningitis. His advice? Don't panic. Talk things over with your physician first to see if